So today we'll discuss about coronary arteries. What are the arteries? Coronary. If you see this corona, what is corona means? Corona is nothing but sun rays. When you see the sun, if you write a diagram of the sun, it is put like this only. Sun rays. When they did autopsy on the dead body, they have seen the heart and they have seen the blood vessels of the heart. When the autopsy is done, heart is like this. We'll see the heart from above. From the aorta, they have seen the arteries coming like this. That is why they named them as coronary arteries. Okay, that's the reason they are called coronary. They look like the corona of the sun. So how many arteries are there for the heart? 2. Yes. Right coronary artery and left coronary artery. Okay. So totally there are 2. Where are they arising from? Both the coronary arteries arising from the first part of ascending aorta. Okay. This is ascending aorta. Where is ascending aorta coming from? It is continuation of the left ventricle. In the previous video, we learnt about the valve called aortic valve, which is present between the left ventricle and aorta. So this valve is aortic valve. This is left ventricle and this is aorta. Okay. So where are these coronary arteries coming from? They are coming from this part of aorta. Right coronary artery and left coronary artery. Okay. LCA, RCA. But usually we see the patients with the heart disease having coronary artery disease. We call them as single vessel disease, double vessel disease and triple vessel disease. But there are only 2 vessels now. Why it is called triple vessel disease? The reason is the left coronary artery actually divides into 2 important vessels. One is LAD, another is LCX, left anterior descending artery and left circumflex artery. This LAD and circumflex, they are equally important vessels. If there is a block in them, we have to treat them separately. That is the reason it is called 1, 2, 3. Triple vessels. The heart is supplied by 3 important vessels. Though there are only 2 arteries, it is supplied by 3 important vessels. So, how do you know whether the arteries, that is coronary arteries, are normal or not? If somebody comes with a chest pain, as discussed in the previous videos, a chest pain because of coronary artery disease, the diagnosis, final diagnosis is by coronary arteries, arteriogram. Otherwise, angiogram. Angio means blood vessel, arterio means arteries. Coronary arteries are diagnosed by diseases present or not by doing coronary arteriogram. Usually we short abbreviation as CAG. This is done by our cardiologist colleagues. When they do coronary angiogram, how is coronary angiogram looking like? How are the normal coronaries are looking like? You can see in the previous video. There you can go and refer. If that angiogram is done, then we will diagnose 99% whether these vessels RCA, LAD, circumflex, three arteries are normal flow is there or not? Are there any abnormalities? Though anatomically there are two arteries, left coronary artery and right coronary artery, but clinically, disease-wise, we take it as 1, 2, 3. Three important vessels. Out of which the most important vessel is, which is the most important vessel? No, it is left antedescending artery. Why? Because that supplies the interventricular septum. As we discussed in the previous video, the septum between the two ventricles is interventricular septum. If the interventricular septum is normal only, the heart will function normally. Because that is supplied by LAD, the most important vessel is left antedescending artery. Okay? Thank you.